This episode of Ham Talk Live is brought to you by Tower Electronics. For connectors, cables, and more, call 920-435-2973 or visit pl-259.com. And by ICOM. Heard it, worked it, logged it. Visit www.icomamerica.com/amateur for more information about ICOM radios.
It's Ham Radio.
Good evening, everyone. It's time for Ham Talk Live, episode number 244. COVID research update for hams, recorded live on Thursday, January 28th, 2021. I'm your host, Neil Rapp, WB9VPG. Thanks for tuning in to another episode of Ham Talk Live. Tonight, we're joined by Dr. Scott Wright, K0MD. And we'll take your calls later on in the show. Last week, Michael Coulter, W8CI, was here to talk about the second cancellation of the Dayton Hamvention. If you missed that show, you can listen anytime at hamtalklive.com or on your favorite podcast app or on YouTube. You can also catch the rebroadcast of Ham Talk Live on WTWW. That's 5085 AM. Saturday afternoons, and that usually runs about 3:30 p.m. Eastern Time. Lots and lots and lots of announcements here before we start. We'll try to make it quick. Winter Field Day is this weekend. Check out winterfieldday.com. There are rule changes for COVID-19, so make sure you check that out. The AM rally is the following weekend. That's the first weekend of February. They encourage everybody to get on AM, whether it's vintage gear or with vacuum tubes or a new SDR, doesn't matter. Get on AM, 160, 80, 40, 20, 15, 10, and 6 meters. It's 0100 Zulu Saturday, that's 7 p.m. Eastern on Friday the 5th, until 700 Zulu on Monday the 8th, which is 2 a.m. on Monday February 8th. So check that out. The Orlando Hamcation Special Edition QSO Party will be a couple of weeks after that. That's Saturday, February 13th, from 10 until 10 Eastern Time, 10 a.m. to 10 p.m. The Special Edition webinars will be from 10 a.m. to 4 p.m. Check that out at hamcation.com. And, of course, the Virtual Ham Expo from QSO Today will return on March 13th and 14th. They've been working on making that better. They have a kit building workshop. You can do, you can order it online and have it ready to go and build it live. And they're also going to have some AMSAT stuff, so an AMSAT booth with representatives from the 30 AMSAT societies around the world and 9 sessions by AMSAT experts. The tickets are $10 for the early bird, and you get the live 2-day period as well as the 30-day on demand. So check that out at QSOTodayHamExpo.com. All right, well, get your questions ready to go for Scott. If you're listening to us live on Thursday night, you can give us a call after talk to Scott for a while. Let me give you the telephone number so you have it ready to go. It's 859-982-7373. We'll give that number out again here in just a second and several times later on in the show. Again, that number, 859-982-7373. You can also tweet us. It's at Ham Talk Live on Twitter. And if you're listening live on Spreaker, you can type in the comments, and we've got a little chat going on in there. So you can do that. And I'll be back with Scott right after this word from ICOM America right here on Ham Talk Live. Happy 2021 from ICOM. ICOM's IC705 gives hours of fun and enjoyment working your favorite bands this holiday season. The IC705 is the perfect sidekick for hams that like to enjoy what both the great indoors and outdoors have to offer. It's the perfect QRP companion, base station features and functionality at the tip of your fingers, in a portable package, covering HF, 6 meters, 2 meters, and 70 centimeters. This compact rig weighs in at just over 2 pounds, with RF direct sampling for most of the HF band, and IF sampling for frequencies above 25 megahertz. It comes with a 4.3-inch color touchscreen with live band scope and waterfall. It runs 5 watts with the battery, 10 watts with a power supply. Sideband, CW, AM, FM, as well as full D-Star functions are available. A micro USB connector, Bluetooth, wireless LAN, micro SD card slot, integrated GPS with antenna and GPS logger. The speaker mic comes standard and supports QRP and portable QRP operation. The perfect accessory for the IC705 is the now available optional backpack, LC192, with a special compartment for your IC705 and room for accessories for soda activations or a day in the park. Other accessories now available include a QRP portable magnetic antenna, standard battery pack, lithium-ion battery pack, micro USB cable, USB Type-C to micro USB cable, a DC power cable, a compact lapel push-to-talk Bluetooth with earphone and a desktop tray. And the antenna tuner is coming soon. And there's free software to download, the programming software, the Android app, the terminal mode access point mode application, and the smartphone picture utility for Android, iOS, and Windows. Also available is the RSBA1 IP remote control software, which requires purchase. Visit ICOMAmerica.com/amateur for more information on ICOM radios.
Coming to you live from the glass enclosed Faraday box, here's Neil Rapp with more Ham Talk Live.
Welcome back to Ham Talk Live. Thanks to ICOM America for sponsoring the show once again tonight. And tonight, Dr. Scott Wright, K0MD, joins us on the Orlando Amateur Radio Club and Hamcation Zoom line. Dr. Wright is the past editor of the National Contest Journal from Rochester, Minnesota. He works for the Mayo Clinic, teaching cardiology, which often takes him abroad where ham radio can go with him. He's an excellent contester and been on several DXpeditions. We met when we were kids in Louisville taking our license exams, and he is a graduate of the University of Kentucky, and he was the co-principal investigator of the COVID-19 convalescent plasma research study at the Mayo Clinic in Minnesota, which is what he's here to talk about tonight. So, Scott, welcome back to the show.
Neil, thank you. Always love your introductions. I remember meeting you in Louisville at the FCC testing session. We've both come a long way since then, and it's just nice that we've been able to renew our friendship in the last 15 years and do some fun things together. Thanks for inviting me on.
Yeah, it has been a lot of fun, and I know you have been hard at work with this project, and it was a very visible project, to say the least. And you know, you had a lot to talk about, and you've been on this show and other shows talking about all of the work that was going in, and now the results are out. So we wanted to make sure you were back on the show to tell us how the story mostly ends, I guess. I guess it doesn't totally end, but to see what the results were on this and how ham radio ties into all of this. So let's see, that was April 23rd. You were here talking about that research, and then 2 weeks ago, the New England Journal of Medicine. There's a journal for you. The New England Journal of Medicine publishes the results. So give us an update on what happened with the study and what the results were, and then also a little bit about how hams came through helping on this project.
I'd be delighted to, Neil. And thank you again for having me and our teams work on your show in April. Let's trace back to March, April, almost 10, 11 months ago now. We were just in the beginnings of an incredibly scary pandemic. We didn't have really any therapies at the time that we knew that would work to help reduce the risks of dying or progressing with COVID-19. And one of my colleagues at Mayo Clinic, Dr. Michael Joyner, had been asked by the U.S. Food and Drug Administration if he could put together a team of scientists from Mayo Clinic and other centers to test convalescent plasma. Now, many people are still wondering, what is convalescent plasma? Well, everyone knows about blood donations, and sometimes patients get blood cells, and sometimes they need plasma to help with the coagulation in their blood. But convalescent plasma is a special form of the plasma that has antibodies and other viral fighting substances. And we had hypothesized in the early spring that using it would help patients with severely ill COVID-19. When we started the study, Neil, we had two big issues before us. One, we were expecting to enroll about 5,000 patients. And second, we didn't really have a supply of convalescent plasma. And I made a couple of media appearances on ham radio shows, yours and Ham Nation, and subsequently learned from our public affairs experts at Mayo Clinic that those appearances garnered an incredible amount of social media activity and likely resulted in a lot of donation of plasma from people who had recovered from COVID-19. And so the ham community really stepped up, as they always do during a time of crisis, and donated not just their time, but their plasma, those who had recovered from COVID. It turns out that one of the individuals, one of the leaders at the U.S. Food and Drug Administration, Dr. Peter Marks, is also a ham operator. And we figured that out right about the time I went on Ham Nation. And we had a special bond after that, and talked about how ham radio helped us both sort of relax in our free time from the very stressful things we were working on. Peter largely uses his radio on his boat that he sails in the Chesapeake Bay, and was telling me about a QSO with a station in Saudi Arabia on sideband, and how impressed he was with his vertical working on saltwater. And I, of course, shared how I was up in the black hole of southern Minnesota, north central U.S., where propagation was not always strong. And I like to work Saudi Arabia too, but it took a lot more power than 100 watts in a vertical for me to work Saudi Arabia. But I think the flexibility that being a ham operator teaches you, the problem-solving skills, the creative way of thinking, all contributed to how we worked collectively together and collaboratively together to solve this shortage of convalescent plasma, to test the convalescent plasma. And then, as sort of the final act of getting a sub-study published from it. So, like I said, we were expecting about 5,000 patients over the ensuing 6 months, but Neil, honestly, by the end of April, we'd enrolled 5,000 patients, and we were shocked at how the study just took off like a Saturn V rocket launches. And it turned out by the end of August, when the Food and Drug Administration made their decision to issue an emergency use authorization for convalescent plasma, we'd enrolled a little over 105,700 patients.
Wow.
Yeah, it was just one of the largest clinical studies done in history of medicine, frankly. Probably not the largest, but one of the largest. We did it with a team of a group at Mayo Clinic. We assembled the first week of April. And I credit the collaboration model of Mayo Clinic, the support of our senior leadership, the Dean of Research, our Chief Physician, who is our CEO, and others who gave us the support and the access to IT resources, website resources, and just personnel who were temporarily furloughed, not really taken off work, but just didn't have the usual busy schedule because we had to close our clinical practice for a couple of weeks as we anticipated a huge surge so that we didn't run out of personal protective equipment or ICU bed space. And so we were able to recruit a lot of talent who quickly helped us and got everything going. And many of them stayed with us through the duration of the study. And I would love to give you a list of names. Many of them are authors on the New England Journal paper. but I would forget someone, and I don't want to offend anyone, but let's just say that it was a team effort. I'm here on your show tonight, but I'm just one of several people. It's sort of like Michael Coulter last week. He may be the spokesperson of the Dayton Hamvention, but there's a whole crew of people behind him. So, let me tell you what we found. So the study was an observational, pragmatic design, but we knew that the plasma would likely contain varying amounts of what we call neutralizing antibodies to kill the COVID virus or weaken it or to enhance your own immune action against it. But we didn't know which units of plasma would have high levels of neutralizing antibody, which units of plasma would have medium levels or low levels. In fact, the test to test for those hadn't even been designed by the time we were on your show. So our laboratory medicine group, Dr. John Mills and Dr. Ellie Thielen at Mayo Clinic devised and designed these tests in May and June so that we could actually test a sample, not the entire 105,000 units, but a sample of about 3,000, which we thought statistically would give us sufficient power to see if the use of high titer convalescent plasma resulted in a reduction in mortality. So we gave the convalescent plasma. We worked through 10,000 hospital sites and 3,000 physicians. I'm sorry, I reversed that. 3,000 hospital sites and 10,000 physician PIs. So we had every hospital area in the United States with the exception of 5, one being Bloomington, Illinois, and I forget what the other 4 are, and including every U.S. territory. So every hospital in Puerto Rico, every hospital in the Mariana Islands, in Guam, all the military bases overseas were all part of this. The VA system was part of it. Big consortiums like Hospital Corporation of America joined and put all of their hospitals into it. Almost all the major academic hospitals did, but this study was largely done at the small town hospitals across the U.S. And we found we gave the plasma to people who were critically ill, either in the ICU or thought at risk to needing to go to the ICU within a few days. And of course, we found that the people who got the low titer plasma had about a 30% in hospital mortality. 30% mortality at 30 days, not in hospital, but 30 days. And the group who got the high titer plasma had a 22% mortality. So technically, it was a 7.3% absolute risk reduction. And for people who have a background in epidemiology, like one of your prior guests, Dr. Frank Howell, or others who may be listening, the number needed to treat there of 14.5 or so, which is incredibly good in medicine. We think if a number needed to treat is 33 or lower, the drug's very effective, or the treatment. It doesn't have to be a drug. And what we also found, Neil, was that patients who were not on a ventilator had a 36% relative risk reduction in their mortality. And patients on a ventilator did not seem to benefit. There was maybe a 5% reduction, but it wasn't statistically significant, but the 36% was. So the overall results showed a 25% risk reduction, but it was favoring the non-ventilated patients. Now, we didn't test plasma in patients in the emergency room or people at home, and those studies are being done, and they're led by the NIH, and we think the answers will be out shortly. The UK just finished their convalescent plasma study in critically ill patients in the ICU, many of them on ventilators, and basically replicated the same results we did, that being on the ventilator doesn't help. But I think the best way to summarize this is to share a story I had from my own practice 2 weeks ago. I was seeing a patient who needed heart valve surgery. And I said to him, "Have you had COVID?" And he said, "No," but he said, "My wife has." And my alerts went up because we screen everyone for COVID infections, including spouses, before we let them into our clinic. And I said, when were you diagnosed with COVID? She said, "Oh, it was in early December." And this was, of course, just 2 weeks ago. And I said, "Tell me more." And she said, "Oh, I was really ill, doctor." She said, "I was in a hospital," and she named a central Minnesota town. And she said, "I was in the ICU." And she said, "My husband was prohibited from visiting me." And he said, "That's right. I would call every day, or she would call me." And she said, "They told me one day," they said, "Look, if you don't turn the corner soon, you're not going to make it." And she said, "But they gave me this thing, and you maybe haven't heard of it, doctor," but she said, "It's plasma, and it has antibodies, and they gave it to me, and 2 days later, I was out of the ICU and home a few days later." And while we don't make much of single stories, that summarizes sort of our findings. And we kept hearing stories and stories like that all through the study. So we thought we might be onto something. And we were absolutely relieved when the statistical data and the peer review process of the New England Journal, which is tough. It's the world's leading medical journal. They put you through a very solid and appropriately hard peer review, and looked at our data. We, of course, did some revisions as they would have requested, and then they decided to publish it, and they pushed it out early online so that the world could see it and start using it. So that's the story. And, many things in life contribute to giving us skills that help us to do the important tasks that we're called upon to do from time to time. And I have to say that ham radio was very helpful for me. And I think Dr. Marks at FDA would agree it was helpful with him as well.
Well, I had some great stories to relate from all of this. And, I know that, I've talked to a few hams who donated plasma to this project and tried to try to help out, and sounds like it was very beneficial to the study and was saving some lives, and so we gotta love that. Well, how do you see this treatment being used, and where do you think this is going to be used as this goes on for a while longer?
If I could just give a shout out to everyone who's donated, they are the true heroes and the true people who've made a difference. We just designed the study and did the science, but we are deeply indebted to the patients, the recovered patients who donated plasma, who were selfless and altruistic and kind. We talk sometimes about American exceptionalism, and I look at how Americans donated the plasma with no reimbursement. They asked no questions. They put up with the hassles of the donation, and it just rekindles my faith in this great country and what people can do when we work together. Let me say this. We have treatments today for COVID that we didn't have in April and May. We, of course, have the vaccines now, and I hope everyone will get vaccinated. I have. I've taken both vaccines, both doses of a vaccine. Had really no side effects from it, and I hope anyone who has the opportunity to get vaccinated will. The myths about the vaccine are just that, myths. And COVID is often a disease that leaves you feeling pretty weak and exhausted, but it's not lethal, but for a small percent of people it is, and the vaccine can really protect you against both severe COVID and lethal COVID, I think. So let me just encourage all of the Ham Talk Live listeners to get vaccinated when they have a chance. In the United States, we today have at least 3 therapies for COVID-19 besides convalescent plasma. We have remdesivir, which has now become the standard. There are other antivirals that are being used in combinations as a cocktail with remdesivir that I don't really know the names of right now, but they're being used. We have steroids, either corticosteroids or dexamethasone. And then we have monoclonal antibodies, one being made right near where you are at Eli Lilly in Indiana. Now, the monoclonal antibodies are really they take the very best parts of plasma, and they take the antibodies that kill the COVID virus against the spike protein, and they enrich it thousands-fold so that you get a really good dose. And this therapy is life-saving. It keeps 90% or so of people out of the hospital. They get it before they go in. And we have tremendous access in the United States to this. So the need for plasma in the U.S. is less today than it was 3 or 4 months ago because we have FDA approval of the monoclonal antibodies. And that's why patients who get COVID can recover so quickly. So I see convalescent plasma being used in the patients for whom the monoclonals are not available, especially if it's used early in their hospital course, like the first couple of days, or even before they get in the hospital, before they deteriorate. So it's worth talking to your healthcare provider if you get COVID and you think you're deteriorating, if monoclonal antibodies are an option, if you should be on remdesivir and steroids and maybe plasma. But what we feel, Neil, is that many countries and many places in the world do not have access to the monoclonals for a number of reasons, including financial barriers, right? Because we have a wealthy country in the U.S., so we can afford the doses. They're probably $1,000 or $2,000 a dose. I don't really know, but I'm guessing. But many countries just don't have the kind of budgets to support that. So plasma is a very inexpensive treatment that those countries can generate because you just collect blood from recovered COVID patients and then you spend the plasma out, you test it for a level of antibody, and then you save the plasma that's got the highest levels of neutralizing antibodies and use that. So you can treat about 3 people for every donor you get. And so as COVID evolves, if we get a new variant or new strain that our current therapies don't work, convalescent plasma will emerge that should be able to fight the new strain as we get people who recover from it. So it's a public health issue. We believe that its greatest use will be outside the United States in many countries where they have a blood bank system, but they don't have the resources for monoclonals. So at a high level view, that's kind of where we see it being used now.
All right. Very good. Well, one more question here, and then we're going to take a break and take some questions on the phone here at 859-982-7373 and Twitter and all that. But are there still, you mentioned a couple other actually already, other studies that are still going on with this? And then are there any ways that hams can jump in and help here again?
Yes, there are at least two other studies I'm aware of going on. Lisanne Perovsky from one of the New York City hospitals and Shmim Shmuel at Hopkins are leading studies with convalescent plasma as randomized clinical trials. I believe their enrollments are done, but if not, and you have an opportunity to be in one of their studies, I would recommend you consider participating. We also think that it's worth still donating convalescent plasma because we need it. We don't think that the demand for it is predictable, meaning we've seen, I think, 50,000 units used since we first had the FDA EUA. So that's a huge use of plasma. And so there appears to be a strong demand for it, even with the newer therapies. So we still need lots of donors. And so I think hams can donate plasma if they've had COVID and recovered, or if they have a family member or a friend who has had COVID, they can encourage them to donate. Let's stay tuned. We're not out of the woods yet with COVID. It's a terrible disease. It's a huge pandemic. I believe that we're near the end of the beginning of COVID, and I think we're going to turn the corner. I've seen modeling data, Neil, that if we can get 1 million people a day vaccinated through May, the number of deaths should fall substantially. I mean, 99.5% reduction by the summertime. And if that happens, and if those models are true, and again, this is all speculation, but if those models are true, then it'll be a new day in the United States and in the world when we can start doing that. So I think what hams should do is get vaccinated, continue to socially distance as they can, wear a mask, be religious about it. You would never operate on your transmitter, work on your transmitter or your amplifier, or tune your antenna with the RF on and the power on. So with COVID, don't be out without a mask. It's not a political statement. It's a public health gesture that's there to save your life as much as it is anyone else's life. And you only spend your life wisely. You only get one, so to speak, So don't take unnecessary chances and, be cautious until this whole thing resolves. The pandemic will go away. It'll follow the 1918 flu pandemic pattern probably and be gone in another 6 to 18 months. I don't know how long, but we will get through it. Let's just continue to support one another, be on the air, have QSOs, socially isolate, but operate. How's that?
Hey, there you go. And a public service announcement from Ham Talk Live: do not open up the cage of your amplifier and stick your hand in there. So
we both know that, don't we?
Yes,
something about being licensed before you were a teenager that helps you learn that.
Yes, exactly. All right. Well, we're going to take a break here. We're going to come back with Scott and talk a little more about this and maybe some other things too. We'll take your questions and comments after this word from Tower Electronics right here on Ham Talk Live.
Jerry, what's up, man? I haven't seen you at Sunbucks in a while. I used to see you every morning getting coffee. What's up?
Well, I can't afford Sunbucks 5 days a week anymore. I had to spend my money on PL259s. You know, those antenna projects I've been meaning to do. I had to do them before my HOA finds out I have antennas.
That's too bad, Jerry. I miss seeing you and catching up over coffee. You should get your PL259s from Tower Electronics. They have great stuff. Jerry, you're back. Oh, QRM Heterodyne Frappuccino. That's a good choice. How's it going? Did you get all those antennas up before the HOA police showed up?
Yeah, I got them all done. Thanks for telling me about Tower Electronics. Now I can have my coffee. I just saved a bunch of money on my PL259s by switching to Tower Electronics.
Don't get caught without PL259s. Visit Tower Electronics online at pl-259.com or at a Hamfest near you. or give him a call at 920-435-2973. And be sure to pick up some power poles, adapters, and cables too.
Join the conversation. Give us a call at 859-982-7373. Again, the number to call is 859-982-7373. Or, if you'd rather type than talk, tweet us at Ham Talk Live. Now, here's Neil Rapp with more Ham Talk Live.
At Ham Talk Live, we use commercial breaks to debate where the seeds for seedless watermelons come from. Now, here's Neil Rapp with more Ham Talk Live.
Welcome back to Ham Talk Live. We'd like to thank Scott and Jill at Tower Electronics for sponsoring the show tonight to bring Ham Talk Live your way. They're planning on being at the Dalton, Georgia Ham Fest February 27th, but you can still find them 24/7 at pl-259.com. You can find Ham Talk Live at hamtalklive.com every Thursday night at 9 p.m. Eastern Time, and be sure to check us out on Facebook, Twitter, and Instagram. And before we get back to Scott and our phone calls, it's time for the Ham Talk Live Ham Radio Joke of the Week with Rick.
Now it's time for the Ham Talk Live Ham Radio Joke of the Week, the part of the show where Rick tells us a ham radio joke. The Ham Talk Live Ham Radio Joke of the Week is brought to you by QRM Labs. Now, here's Rick Garrett in 9 GSU with today's Ham Talk Live Joke of the Week.
A radio wave walks into the bar and asks for a beer. The bartender says, "Here." But why the long phase?
This has been the Ham Talk Live Ham Radio Joke of the Week with Rick Garrett in 9 GSU. Tune in again next week for another joke from Rick.
Oh, well, Scott, there you go. This is the long phase.
I don't know how Rick comes up with these jokes, but he's very talented. Neil, you must be paying him exceptionally well.
He's getting paid twice what you're getting paid to be on this show, so.
Oh, no. Then I know what he's getting.
To let you know. Well, it's time for your phone calls. Oh, go ahead.
No, 2 times 0 is still 0, right?
Yes, it is. It is. Absolutely. Well, it's time for your calls right now. So if you have a question or comment for Scott, give us a call at 859-982-7373. He'll give you the number here again in just a second. Or you can tweet us. It's at Ham Talk Live. And if you're on Spreaker, you can type in the chat here. And if you're listening to us on WTWW right now or on the podcast edition or not here right now, it's not live, so we're not there. So we're taking the live calls here, and we already have one on the line. Good evening. Welcome to Ham Talk Live, Andy.
How are you fellas doing, Scott and Neil? It's good to hear you all on there. Scott, I'm doing what I can. I just donated Tuesday again. I think this is my last go-around. Hopefully you guys can get a handle on it. And I donated, 7 months ago, I guess we started this program, and here I am still donating. So this one goes toward to Fort Meade, I guess, and they divvy it out from there and see what develops. My name's Andy, Alpha Alpha 0 Whiskey X-Ray. But hopefully we're doing the right thing. What say ye?
You know, Andy, you are doing the right thing, and on behalf of all the medical community, let me thank you for being such a kind and caring person to donate. Your altruism is wonderful, and I know this is so common among hams, and you've really helped a lot of people. 2 to 3 people will benefit from each time you donate. So thank you for all you're doing, and I like your call. You must have been in the zero land at one point and enjoyed our great propagation and our best season of the year winner.
Yeah, it was pretty good over in Colorado. I was over there with Amanda and all that crew. At that time, it was Kilo Echo 0, Alpha Yankee Juliet, and then a hurricane took me away to Puerto Rico with Val. And we ended up over there, and I became KP4 Alfalfa November, and now I'm back stateside, and I'm Alfalfa Zero Whiskey X-Ray. And, of course, it stands for Andy Anderson, and the last two is weather. I'm always involved with the weather somehow, so don't blame me for the cold weather up there. You chose where you live, and I'm where I'm at. But, yeah, I've done just about all the donations I could just about do. This last batch, I went over to Kankakee and did plasma there, and then I got to do a blood draw in 2 weeks down in Florida that goes to Fort Meade, and they're going to look at that, see what's going on with my system, why I still have high antibodies but no infection. So we'll see what develops with that.
That's great. Well, congratulations on having a good immune response.
Yeah. Well, I have to admit, Andy is one of those people that I said, I know some people have donated. Andy was telling me about it. We were going to try to get together. He's back over here in the Indiana area, and we just kept missing each other. But one of these days we're going to catch up, Andy.
Yeah, we could do that. That lemon custard sounding better all the time.
Let's see. Was that chocolate mousse that has that lemon custard? Is that where that was?
I don't know. It was downtown Bloomington there, and I can't remember if that place is still there, but it had lemon custard. Now
I believe that's chocolate mousse. So they've got a new building, but they're still there. So we'll have to do that sometime. Well, Andy, thank you so much for calling in, and thank you for your contribution to this effort too.
Well, it's like Scott's saying, we can win this thing. We can beat it, and just take everybody to believe that and stay on the wagon with us, and just remember it. We're going to do it.
We are, and thank you also for all of your help down in the Puerto Rico disaster, and you're just helping everybody out. So we really appreciate all that you've done, and it's that ham radio spirit, and I applaud everything that you've been doing here, especially these last few years that has been a little more public, but we really appreciate it.
Okay, we'll say 7-3 to you both, and let somebody else get in there and talk a little bit, and a little bit of education and a little bit of storytelling, and everything gets settled up that way. Appreciate you being on tonight, Dr. Scott. And Neil, take it easy. 7-3. We'll talk at you later.
Thank you. 73.
Right. Thank you, Andy. 7-3. 859-982-7373 is the phone number to give us a call. We have a few minutes here to take some calls, so give us a ring at 859-982-7373. Over in the chat and my text on my cell phone, which we don't normally give that number out, but this person has it. Ryan, KD9DAB, says loves to hear numbers like that and love and listen to the show tonight, and thanks to Dr. Scott Wright, K0MD. So thanks for listening, Ryan. I hope you enjoy it. And Chris, AA4CB, is tuning in again tonight. So thank you, Chris, for always being there, and appreciate you listening. And let's see if we have anything over here on Twitter. Jim Wilson, K5ND, says, congratulations to Scott on his very successful 3-year tenure as editor of the National Contest Journal. That's actually on my list too. Impressive to squeeze that in amidst all of this work. So thank you also for that. And we have another call on the line. So let's go to the phones. Bloomington, Indiana. Hello.
Hey, Neil. It's Ryan, KD9DAB. Long time no talk.
Yeah, it's been a long time. Now, I saw the caller ID. I thought I'd do my tribute to Larry King there, and Bloomington, Indiana. Hello. So, well, go ahead, Ryan.
Yeah. I just wanted to say thank you to Dr. Scott. I knew that you had been involved with some of the studies with COVID and stuff like that. I've seen that around on Twitter. read the paper and then saw your name on it. That was really cool to see. I've been keeping up on it. I'm not sure, we haven't caught up in a while, but I'm actually studying epidemiology during this crazy time. So that was really cool to see the connect, and it's great to hear Ham's helping out during this unprecedented time.
Thanks, Ryan. It just seems like the other day we saw each other at Dayton, and you were getting awards and leading the K9 SOU Bloomington South High School Club, and Neil told me during break that you are a grad student now at IU, so congratulations on all you're doing. And I have to say, what an exciting time to be studying epidemiology. It really brings it home, right? Bill Gates in his letter, he and Melinda Gates, to the letter to their foundation and the community writ large, said this past week that this is the year that global health became global. So how exciting, Ryan, and hopefully you can get involved in some studies and do some things while the pandemic's going on to help with your education.
Yeah, I was also thinking about this semester. I'm taking 2 classes that are perfect for this time. I'm taking infectious epidemiology and then public health informatics. So all this data wrangling with contact tracing and stuff like that, we got to figure out the backbone of it. That's my plan this semester. So I really appreciate all that you've done. I also read your paper about the heart attack risk with homeless populations. That was really awesome to read. At IU, we're really kind of pounding in social determinants of health and stuff like that. So that's fantastic to hear.
Oh, thank you. Yes, that's a very sobering set of data. For those who are listening to Neil's show tonight, we published a paper in the Mayo Clinic Proceedings showing that if you are homeless and have a heart attack, your risk of dying is probably double what someone who's not homeless is. So it's an important group of patients to pay special attention to. And, you know, Ryan, I want to give a little shout out right now, if I may, to the dean at the Ohio State University Medical Center. They actually have mobile units that go out and try to treat homeless people and to do follow-up care. And I wish all of the major hospitals would do what we're seeing that the chancellor has started at Ohio State. The Ohio State University Medical Center. Yes. I realize that both the IU alumnus on this call and the UK alumnus on the call have probably had painful memories watching our teams lose to the Ohio State. So, but when it comes to public health and global health, we put all that aside and work together.
Absolutely, 100%.
Well, Ryan, thank you so much for giving a call tonight, and good luck with the studies, and keep on working on all that epidemiology. And that's a fabulous time to be studying that. It should hit right home.
Right on. Well, thanks for having me, Neil. Both of you guys stay safe, and I'll catch you sometime later.
Thank you, Ryan. Nice to hear from you. 73,
Ryan.
We have a very interesting story during the COVID study in New Hampshire. We had a couple of patients who wanted to receive convalescent plasma, but they were unable to take it because they were both critically ill and unable to give informed consent. And we had 2 other mechanisms for patients, for their families or others, to provide the informed consent, but the laws in New Hampshire blocked it. But the families really were asking if we couldn't do something. So we actually harnessed our connections and used social media to get in touch with the governor's office, and they were able to pass either waive a requirement or pass a law to allow during pandemics for patients to have access to experimental therapies without specifically having to do written informed consent if they could give other acceptable means of consent. So it was a very interesting troubleshooting experience that we had that you don't hear about very often.
Very, very interesting. Well, Scott, I'm looking at the clock, and it's already over time. So I do want to mention one last thing here before you go, because we just haven't had you on here because you've been so busy with all this. But Jim Wilson mentioned it. Congratulations on the 3-year run as the editor of the National Contest Journal. I know that you had to kind of get some relief on that throughout the last little bit of your term because of all the research going on. But thank you for all of that support, and thank you for bringing me on there and starting to contribute. And you've got a new editor that's taken over for you.
Yes, Lee Finkel, KY7M, a longtime contester, very experienced writer, attorney by training, and academic by training, has taken over and is doing a wonderful job. Neil, I just have to say that two of the best decisions I made as editor were to recruit you and Jim Wilson as authors. And both of you touched audiences and brought material that no one else had ever done before and made the journal much better. So thank you for the kind words, but really, like this study, the credit belongs largely to those who did the writing and the hard work. And so thank you, Neil, for putting up with us every 2 months. It seemed always at a challenging time from our schedules to get the articles in, but you did it, and you did some great interviews. In almost every issue that I was editor, we had someone who was a younger person, a youth contester on the cover, which was great. And we did our part to help grow ham radio among younger operators, and Jim helped us with explaining a lot of VHF and UHF contesting tips and tricks and techniques. And it was just, both of you just brought tremendous value to the journal. I hope that you'll both continue writing for it for the long time. And I want to say, I'm working right now on a series of articles for NCJ about what we call gateways events to contesting. So I'm looking forward. Frank Howell and I have some exclusive data from the ARRL that we're analyzing, and looking forward to submitting that later this year to NCJ and also to QST. So even though I'm no longer editor, I carry the title past editor with great pride, and the passion for writing hasn't left. So I'll be, you'll probably see works from me from time to time being submitted.
Well, we look forward to it. Thank you so much for all of that, and thank you for being on the show tonight again to fill us in on the next chapter of this whole study, and really appreciate all that you do, and I appreciate your friendship and your willingness to come on here and talk about all this stuff. So thank you so much, and we'll do it again soon, I'm sure.
Thank you, Neil, and give my best to Julie, your lovely bride, and congratulations again on your wedding earlier in 2020.
Well, thank you so much. All right, well, we're going to finish things up here tonight. That is a wrap for this week's edition of Ham Talk Live. Thanks to my guest, Dr. Scott Wright, K0MD, and everybody out there in cyberspace for listening and calling in, typing in, and invite you back next Thursday night, 9 p.m. Eastern Time. And for a list of our upcoming guests, visit hamtalklive.com. And if you like the show, please leave us a review. And actually tonight we're going to announce a new little contest that we're going to do. We're going to give away some free T-shirts out of the iTunes reviews that are posted between now and the end of February. So if you go to iTunes and leave a review, and we'll go through how to do that real quickly here. Make sure you include your call sign so I can find where to send everything. But we're going to give out some free T-shirts to those that leave us a review. So what you want to do is open up the podcast app if you have an Apple iPad or iPhone, or iTunes on your computer if you don't have a mobile device that has the Apple Podcast app on it, and search for Ham Talk Live, click on the logo, and then if you just scroll down, it'll say write a review. And again, make sure you leave your call sign in there. So if you're an iTunes user, which most podcasts listeners actually are, statistically anyway, it's about 70%, I think it is. So, if you're not, leave us a review elsewhere, but we're going to do the T-shirt giveaway on iTunes. So leave us a review, and that'll help others find the program faster. So for now, this is Neil Rapp, WB9VPG, saying 7375, and may the good DX be yours.